Real news for Americans 50 plus. This is Emeritus News Channel. And now a partial rebroadcast of a Centers for Disease Control news conference. Questions and answers from reporters regarding swine flu vaccinations and treatment.
I think the bottom line here is we will look very, very carefully to see whether there's a problem with this vaccine in terms of safety. We don't anticipate that there will be. It's produced in the same way the flu vaccine is produced each year. It's a new strain, just as we put new strains into the flu vaccine each year. And flu vaccination has a long-term, very good safety record with literally hundreds of millions of doses having been given.
Operator, next question.
Thank you. Our next question comes from Helen Branswell, the Canadian Press.
Hi, Dr. Frieden. I was hoping I could get you to talk about something you touched on earlier, the balance of identifying when people need to seek care. Some people will, think they're fine and then start to get worse and need to go see a doctor, and they may be outside the 48-hour optimal treatment window for antiviral drugs. Is CDC recommending that doctors think about treating with antivirals, start treating with antivirals later than 48 hours if it looks like somebody's developing severe disease?
If someone is severely ill, then they should be treated even if it's more than 48 hours. But the most benefit, the most good is done if the treatment is within the first 48 hours. Should we take some questions from the room?
Sure. Hi, Dr. Frieden. My name is Brooks Blanton. I'm a producer with Fox News. I just want to ask a little bit more about the vaccination that Novartis and Sinovac in Chinese and Switzerland. They've announced that they have a one-dose vaccination. Is that something that we're going to see here in the United States? Are we going to be able to have a one-dose vaccination as opposed to two?
We need to look at the data as it comes out. The Novartis study, I believe, was done with an adjuvanted vaccine. It's a vaccine that has another material added to it to boost the immune response. We don't anticipate that we will be using adjuvanted vaccine in most of the scenarios that we anticipate now, although that could change. And we would expect that the likelihood of needing two doses with a vaccine that's not adjuvanted is higher than with an adjuvanted vaccine. And for the data coming out of China, we'll have to review it. For seasonal flu, for kids under the age of 9, we currently use two different vaccine doses. So it's very likely that at least for kids, two doses are going to be required, but only time will tell. This is one of the things. Our basic message here is we're going to look at the data. We're going to understand the situation as well as possible and provide the best possible advice for people to have the best options to take to protect themselves and their families.
Question in the room?
Harry Samler, CBS Atlanta News. A lot of parents are very concerned about this. If they feel that H1N1 starts, or they learn that H1N1 starts popping up in their school or their daycare center, if they don't feel that the school or daycare center is taking the necessary precautions, should they pull their kids out?
We hope that schools will continue. Kids need to learn. Parents need to work. There's a lot that happens at schools that is very important. We've had a handful of schools closed, most of them just for a day or two. If your kid is sick, please keep them home. They'll get better quicker, and they'll not infect people around them. Schools should ensure that kids who are sick are separated and sent home with parent or caretaker, and that kids cover their cough, cover their sneeze, and wash their hands. If those simple steps are taken, the number of people who become infected will come way down. And when vaccine becomes available, schools will be an important location to give the vaccine in many parts of the country.
Are there questions in the room? Operator, we'll take another question from the phone.
Thank you. Our next question comes from Maggie Fox, Reuters. Please go ahead.
Hi, thanks, Dr. Frieden. I want to ask the 36 children who died, how does that compare to a typical influenza season? I know there's no such thing, but can we give just kind of a range? What's given in the report is more given in percentages. Can we talk about the compressed time period during which these deaths took place? Thanks.
child deaths from influenza are really tragic, and they're one of the things that has prompted us to recommend broad-based influenza vaccination for children even before H1N1 came around. Each year there are on the neighborhood of 50 to 100 deaths from influenza among children in this country. In this year, only time will tell what that number is. The flu season this past year was very unusual. Very unusual because you had first a normal flu season, which was a relatively mild season. Then you had H1N1 influenza. So these deaths are outside of the normal time period, and again, only time will tell what will happen in the fall and winter. The take-home message from this study, I think, is that particularly kids with underlying conditions need to be treated promptly if they develop fever, and first on line or at the front of the line for vaccination when it becomes available.
Thank you. Operator, another question from the phone?
Thank you. Steve Sternberg, USA Today. Please go ahead.
Hi, Dr. Frieden. Thanks for taking these calls. There was a note in the report on influenza in the southern hemisphere that struck me. It said in Argentina and Chile that among hospitalized cases of acute respiratory syndrome, kids up to 4 years of age were the most affected. However, both countries report that only a low percentage of cases, 20 to 30% in this age group, represent 09 H1N1, whereas more than 70 to 80% represent respiratory syncytial virus. Could you explain and expand on that?
In parts of the country and the world where flu is spreading, it has been very important within the hospital for hospitalized patients, particularly for patients in intensive care units, to determine what type of infection they have. And the testing for influenza, not only is it not necessary for most people who have only moderate or mild illness, but for those with severe illness, it's not sufficient because there are many false negative tests from the available tests. So in areas where there are large numbers of people in intensive care units, doing very vigorous investigation to figure out what's making them sick is quite important. And we have seen in different parts of the country, different parts of the world, that it isn't always H1N1. It can be other things. And only testing at that intensive care unit level of care can determine that.
Question for you?
Hi, I'm Steph Down with Fox. I just had a quick question. In the Southeast, what are you seeing? I know we're seeing a lot of flu activity. Do you attribute that to the return of schools earlier than the rest of the nation, or what do you attribute that to?
We're seeing a lot of H1N1 influenza scattered around the country, particularly in the Southeast, and the most likely explanation for that is that schools started earlier here. In Georgia, we have relatively widespread H1N1, and that again is most likely because we had the schools starting earlier. It may also be that some of the parts of the country that had less of H1N1 in the spring may see more of it now, but only time will tell. This is one of the many things that we have to monitor very carefully so we can figure out what's going on and adjust our approach based on what's actually happening.
Operator, we have time for 2 more questions from the phone.
Thank you. Robert Bazell, NBC News. Please go ahead.
Thank you for taking the call. I just want to follow up on the Institute of Medicine report on the N95 respirators. As you well know, there's not a lot of them in a lot of healthcare facilities, and maybe even only a week or two supply in many hospitals. And there's some in the strategic reserve, but given that there is a potential shortage of these if there were to be a very large outbreak of disease, how would you like healthcare workers to respond to this information, and how do you think they should respond?
We have just received the Institute of Medicine report. We're studying it carefully. Their charge was specifically not to consider either economic or logistical concerns such as supply. And as we look at guidance for healthcare facilities, we'll be looking at this carefully in the coming days to weeks.